My name is Joe Gigliotti. I'm originally from Cleveland, Ohio, and I now am studying both medicine and business, and I'm a CrowdMed ambassador. The diagnostic process, from my perspective, is sort of a pattern recognition process. The problem is that any physician or care team only has a limited experience and a limited knowledge base to draw on. It would be illogical to expect that any medical team, would know everything that's out there, to know. I think one of the limitations that could be overcome by a system like CrowdMed is that, someone around the world might have read a latest piece of literature, or they may have a relative who has a series of symptoms that they recognize that is outside the experience or knowledge base of a medical team. And if that's the case, they may have something, helpful to contribute to a patient case that the team couldn't otherwise bring. A lot of times in the first few years of medical school, you're sitting in lectures and you're taking in information sort of passively. And you're wondering, how can you use it? And I think the nice thing about CrowdMed is, from a student perspective, it's a very educational process because you can spend time quietly reading resources and familiarizing yourself with things. So you feel compelled to really use the information, which also makes you compelled to seek out the most useful information. One of the things that really excites me about being involved isn't just what CrowdMed is today, but is also where CrowdMed could possibly go. Whereas a few years ago, at the end of the health system, you're sort of in an abyss. Now there's this next step that you could possibly take. And I think that that's very powerful for patients and should be explored.